what are the possible methods to detect head and neck cancer, and what is the treatment for the same?
Head and neck cancer, there are certain types of head and neck cancer. We can divide into the oral cancer or mouth cancer, and other than that is the larynx cancer, and other than that it's a secondary cancer to the neck. There may be a cancer in other parts of the body which might present in the neck also. So detection, basically most of the time, clinical examination is very important. If a clinician, a doctor, if you went to a doctor, if he sees anything changes in the oral cavity, any new swellings in the neck, these are there we can detect basically early. As a population, what you should know is there are some symptoms which are specific for these head and neck cancers, like any swelling in the neck. Other than that, change of voice. For example, there is a voice box cancer is present, you will have change of voice. It may be hoarseness, you may have a rough voice which is not going. Something if you have sore throat, the voice, such what kind of voice you have, that voice. But if it is not going beyond certain, like 3 days or 4 days, that may be a sign of cancer. Other than that, if there is you are not able to swallow foods, like any throat, anything is in the pharynx, nasopharynx, that is the backside of the nasal cavity. There can be, like, we have difficulty in the breathing, or you will be struggling to take breaths, and difficulty swallowing foods. These are the symptoms wherein you will know there is something wrong with the head and neck cancer. Coming to the treatment part, treatment for generally any cancer is divided into 3 parts. Generally surgery is main thing, first thing. Other than that, chemotherapy we give and radiation therapy we give. And most of the head and neck cancers, even a little bit late detected also, results are quite good in the head and neck cancer, because surgically we can clear the disease in the most of the head and neck cancer if detected in stage 1 or stage 2 or stage up to stage 3 also. So for the tumors which are in the oral cavity, like tongue cancer or buccal mucosa, that is cheek, with surgery is the main form. After the surgery, based on what is the findings of the report, like if there is any spread, like there are chances of again recurring is there. There are certain factors which we see in the report, like what we have removed. Based on that, we again give radiation therapy after the surgery, and maybe chemotherapy also required in the thing. Other than this, for lymphoma, as I told, the treatment usually chemotherapy. Chemotherapy is giving anti-cancerous injections via in the veins via medication. This is one thing. For certain tumors, is only radiation therapy is the treatment. Like I told you, nasopharynx tumor, the only radiation therapy is treated. And one more important tumor in the head and neck region is the thyroid cancer. Thyroid cancer is, even though we detect very late stage also, chances of cure is very high in the thyroid cancer. Compared to other cancers, thyroid has a very good survival rate. And most common and the most important aspect of treatment in thyroid cancer is surgery, wherein we can surgically remove the thyroid gland and also the lymph nodes, and that is present in the neck, that may be if there is a spread to the other nodes, or there is a possible potential risk for the spread. So thyroid cancer can be treated surgically. And other than this, chemotherapy and radiation therapy are most of the time part and parcel of the treatment if required, based on the final histopathology report.